Greetings, everybody, and welcome to the presentation on how to heal your joints with regenerative medicine, an introduction to stem cell therapy and regenerative cell therapy. This is brought to you on behalf of Dr. Jamie Newer and myself, Dr. Vitale. First thing you may be asking yourself is this workshop worth your time? I understand your time is very valuable, and so is ours. And today what you're going to learn is how you could stay active longer in life without joint pain. We're going to learn about research-backed solutions to joint pain and damage that you will not hear about from your general doctor or orthopedic doctor. We're going to talk about a non-surgical method of healing joint pain long-term so that you can live your best life, and also avoid bad healthcare decisions due to lack of information or biased information. So before we get started on the seminar, what I want to do is I want to go over a couple of case studies here, starting with Marie. Marie, give me an idea of what you were feeling before you got this done. How are your knees feeling?
Well, I have a very severe case of arthritis in my right knee. It's in all three compartments. And I'm a candidate for a right total knee replacement according to my other doctors. I wanted to try this first, and I'm so glad that I did, because the swelling in my knee is so much reduced that I haven't seen my knees this close to the same size in years. I can go up and down stairs again with a regular gait instead of that hoppy little kid step.
Good.
And I am so pleased to report the pain levels are down too. So less inflammation, less pain, better function. I would recommend this.
Good. And you also mentioned the grinding feeling too went down, which is fantastic.
That is totally amazing.
Good.
I do yoga. If anyone does yoga, you know the stance required for Warrior 2. When I bent my knee out toward the second toe, and all of a sudden there was not that grinding feeling that kept me from wanting to go on with the movement. It was just totally amazing. This was 10 days out from the first injection. I could actually do Warrior 2 without pain,
All right.
and I was so happy.
Good. Well, we're glad to hear it. We're very glad to hear it, and thank you for doing this for us. You take care.
Thank you.
So as you could see, Marie's life changed drastically after this treatment. Let's go ahead and hear from Glenn, and then we're going to get into the rest of the workshop. Hi there, Dr. Vitale here with Glenn, and he had gotten his injection, was it 6 weeks ago?
Yeah, 6 weeks ago. 6 weeks ago, exactly. Yep.
6 weeks ago, exactly. So just kind of take us through what you've been feeling up until the injection and where you're at now. Just simple.
Okay. So before I came in, basically my knee was at a point where I was in constant pain. Anything I did was just in general painful, walking upstairs, downstairs, and really hindering just basically my everyday life. And I had the injection about 6 weeks ago, and since from the time I had the injection to now, it's been a complete 100% life changer. I'm able to basically do, walk without any pain, go up and down stairs, just everything that I do in my everyday life is completely normal, whereas before it wasn't. And so I'm glad I came in. It's been a complete life changer, and I'm looking forward to the next 6 weeks and just the future of my progression and just getting back into the routine of just being trying to see if I'm athletic again.
Yeah, and it's nice because right now it's only been 6 weeks, but it takes 8 to 12 for some tissue regeneration to occur. So you're just really in the beginning stages of this. So we're really excited for you, and I'm glad that you had this positive of an outcome as most people do. And I'm glad you're able to share it with us. Thank you.
All right. Well, thanks for having me in, and I'm looking forward to working with you guys some more.
Absolutely. So these are a few of hundreds of case studies that we've treated successfully through regenerative medicine. I wanted to share these 2 case studies with you before we get into it, just so you could see that if you could fall into the same category as these folks, as chances are you will if we accept you as a candidate, it is a complete life changer and definitely worth your while and investigation. So let's go ahead and introduce you to the team. Dr. Jamie Newer is our medical director and creator of the RegenCore method. She's a Stanford graduate with a degree in biology. She got her medical degree from UCLA. She has done her residency in family medicine at O'Connor Hospital and a fellowship in sports medicine at O'Connor Hospital through Stanford University. She has over a decade of experience in sports medicine, and she treats hundreds of patients with regenerative medicine every year with a very high rate of success. My name is Dr. Vitale Moseson. I have 17 years of experience in musculoskeletal care. I have contributed to the creation of the RegenCore method alongside Dr. Jamie Newer, and I've managed over 4,000 joint degeneration and injury cases over my career. Currently, I help medical doctors implement regenerative medicine into their practices so they could also help people in their communities with a non-surgical, proven treatment that is safe and effective and keeps people active into their later years. So if you're experiencing joint pain, this talk is definitely for you. This talk is for you if you're having trouble going upstairs or getting out of a chair. I want you all to understand that being able to go upstairs and get up from a chair without pain is a part of normal living, no matter what your age. Now, how do I know this? Is because the oldest person that came to us with a walker and eventually walked out was 103 years old. And I promise you I didn't fix his age. What we did do is we fixed his joint. Okay. Do we do this for everybody? No, I wish we could. We only accept patients where we know that we can get a positive result. So this is not for everybody. The big thing is whether or not the person came to us before it was too late. Osteoarthritis or arthritis, as you know, is known as progressive and degenerative. What does this mean? It means that it gets worse with time. If you do nothing to slow down the process, it only goes in one direction, okay? And this is why it's important to identify and stop osteoarthritis or any kind of joint pain before it leads to something more troublesome. So this talk is for you if you're 55 and over but still think you're 35 and don't want to give up the activities that you had enjoyed when you were 35. Like jogging, playing golf, tennis, or working in the garden. Maybe things as simple as walking on the beach or even just going up and down stairs or just getting out of a chair or a challenge. This talk is for you if you feel like your pain is causing you to do less and less. So what you are going to learn today is how to stay active, healthy, and pain-free into your golden years. You're going to learn about the 3 most common types of regenerative therapies, modalities available in the U.S., which are responsible for reversing aging and damage in joints. You're going to learn about which conditions benefit most from stem cell therapy or regenerative cell therapy. And you're also going to discover on how to decide which of these 3 available therapies may be best to treat your unique condition or injury. We're also going to learn about what to avoid when searching for a clinic to receive treatment. You have to find a qualified clinic that has a qualified full-time medical specialist. We're going to get into all of this, and by the end of the presentation, you are going to be well educated on regenerative medicine and your options. Our promise to you is after this workshop, you're going to gain clarity on what's available to you in the medical world that was typically reserved for athletes or the elite. You'll walk away from this workshop with a clear action plan to become more active, healthy, and pain reduced long term without invasive surgery or dangerous medications. Because this is an evolved approach to joint pain. This type of information is rarely delivered through an online workshop like this one. It's usually happening in closed consultation rooms of top specialists. And this is not part of the failed conventional medical model when it comes to joint pain that you would find in some of your major hospitals or your regular doctor's office. This is often covered up by most doctors who are either not familiar or have another specialty that they would prefer to use. So this isn't something that is widely talked about. Although it works and it's safe and effective, this is something that you still have to search for. Hopefully not in the future, but at this point, this is where it is, even though it's proven safe and effective. So stick with me until the end, and we're going to give you a gift to decrease your joint pain that has a $767 value. And this includes a one-time opportunity for a significant discount on treatment if you're deemed a good candidate. And we're going to give you details at the end of the workshop. So let's talk about why you're still in pain given all of these medical advances and all the top surgeons. Why are people still in pain and confused when it comes to joint pain? First, it's very important to understand that it's not your fault. People are simply being directed by the conventional medical model and prescribed the tools that are available to them. Information and your care plans are being led by educated and caring doctors, so it's not like there are bad doctors trying to mislead you. They're educated, they're well-meaning, but they do have a lack of information and access unless you specialize in regenerative medicine. So some people will try to ask their general practitioner or the orthopedic surgeon about regenerative medicine, and they really don't get a clear answer. It gets brushed under the rug just because they just don't have the right information. They don't specialize in it. They specialize in what they do. But the information is out there, and this is why we're here, to present it to you. So I have a question for you. What if I prove to you today that there is a safe and effective, proven, non-invasive treatment to repair joint pain on a cellular level, reverse your pain, have you potentially avoid surgery in the future, getting your active life back as a result? Would you invest in this treatment even though it's not covered by your health insurance? In most cases, I get a resounding yes, and I would do the same. So before I get into the rest of the presentation, I want to talk to you about kind of my drive and my motivation and story behind why I got into healthcare and regenerative medicine specifically, why I have such a passion for this. What you see in this picture is my oldest daughter, who is now 12, and my mother-in-law, who unfortunately is no longer with us. And if you look at the picture here and you look at her hands and the chair that my mother-in-law is sitting in, you could see that she had some really bad arthritis. She was diagnosed many decades before with rheumatoid arthritis, where your joints will start deteriorating all over your body, and it's a very painful and slowly debilitating disease. And I watched this poor lady suffer for years, and she's had dozens of surgeries, been on multiple medications, and at that point I didn't really get into regenerative medicine. She passed away just as we're starting this, but basically she was on so many medications and she had so many surgeries that her body just couldn't take it anymore. She passed away at a young age just from too much medical and chemical intervention. And had this been available to her a few decades back, where we could actually regenerate some of her joints and not replace them with metal and give her medications, I think that we would have had her for 10 plus more years, if not more. And just watching her go through this showed me that something was extremely wrong with the conventional medical model, and we just didn't understand why this had to be kept a secret. So small medical offices like ours started utilizing regenerative medicine and offering it, and we have treated people that were just before my mother-in-law's stage, and they're doing so much better. And I really wish she had access to this, but we can't take anything back. All I could do is choose my path and honor her and help other people out so they don't have to go down the same route. So what we're talking about here are the disadvantages of the traditional medical options. When you have a joint condition, what they will do is they'll give you some medication like an anti-inflammatory or some pain medication, but we obviously know that doesn't fix anything. They can be very addicting and damaging. They could increase, your tolerance could increase to them. You could be dependent on them. So we understand that medications are just, for emergencies, a quick fix. But if medications don't work, and physical therapy certainly doesn't work for regenerating joints, it's good for stability. They'll send you to start getting cortisone injections, and cortisone injections fall under the same category. I mean, they'll give you short-term pain relief, if that. But in exchange, what happens is it actually eats away at your cartilage, and it will weaken your bone. And over time, it actually speeds up the condition that we're trying to reverse in exchange really for some short-term pain relief. So a cortisone regimen definitely isn't a good long-term plan either. But when that all fails, what happens next? They move you on to surgery. And in the case of knee degeneration, let's say, if they've tried everything, then they'll say, oh, if you're old enough, late 60s or something like that, then let's go ahead and do surgery. Surgery has its complications. First of all, it's not a slam dunk. It's not a guarantee of results at all. And it's got its complications. You have risk of infection, rejection, even cleanouts, meniscus cleanouts, and the orthoscopic surgeries. They can cause early degeneration. Although they try to put the fire out in the beginning, it causes problems long term. So basically, they don't really have a fix for this. And they're missing a big piece of the puzzle. This is all degenerative care. So this is kind of where we come in, and we disrupt this process. Before we get into our process, I'd like to talk about the phases of degeneration, and so you could see the different phases. This is a knee, and in phase 1, you could see the inside compartment of the knee in most cases is the first to wear out, because this is the most weight-bearing part of the knee. So you'll notice that the space in the inside of the knee is a little bit less, and that's why people will feel pain on the inside of the knee a lot. If they're just naturally deteriorating. So this is what you see in phase 1. In phase 2, you could have both compartments starting to become deteriorated, and as the femur settles down on the tibia, you could see it becomes slightly misaligned and it'll become unstable, and obviously with that comes more pain. And as we move into phase 3, you could really see that the bone is getting really close to the other bone, if not touching it, and you start to get these bony outcroppings called bone spurs. And these could be really painful, and you get even more instability. So this is kind of the journey of the degenerative process when it comes to the knee. The sooner you get regenerative medicine treatments, the better, because obviously you have more tissue to regenerate. Once you get into these phases, it's a lot tougher to get you out of pain. Now, we have treated people in phase 3, but if we're talking more of a long-term fix, you should come in earlier. These people could still be helped in phase 3, but we would much rather see you earlier, because you have a much better chance of long-term healing. So these are the basic 3 phases of knee degeneration. So when it comes to phase 3, let's say you've tried everything, what the conventional approach will do is they'll say, hey, let's do a knee replacement. Well, a knee replacement's no walk in the park. And unfortunately, a lot of surgeons still talk about a knee replacement like getting a haircut. And it's a very difficult surgery to recover from. First of all, there's discomfort. There's no guarantee of results. A pretty cumbersome rehabilitation process with no guarantee, like I mentioned, of results. And it's got a high failure and complication rate compared to other joints, like a hip. The knee replacement is tough. And if you could avoid any joint surgery or any joint replacement, obviously that is the preference for most people. But in the case of knee surgery, it seems like 50 or more people will need, 50% or more actually need an additional surgery. And the cost is also pretty astounding. Even if you have insurance, there's an out-of-pocket cost. And this isn't to mention the downtime and the risk of your risk of infection, risk of rejection. So basically, before people go for knee replacement, of course it makes sense to explore something that is minimally to pretty much non-invasive and has a very good track record and a lot of studies behind it, like regenerative medicine does. So we are a regenerative medicine group called RegenCore, and we're dedicated to treating joint degeneration and injury through non-invasive, non-surgical procedures that are scientifically proven to reverse the aging process of joints and promote healing. Treatments include regenerative cell therapy and non-surgical joint repair programs. So let's talk about regenerative medicine. What is regenerative medicine? Regenerative medicine involves the delivery of specific types of cells or naturally derived biological products to help stimulate the natural healing process in a degenerated or damaged area of your body. Most regenerative medicine injections involve the use of growth factors that cause regeneration, revascularization, and tissue regeneration. And they also can involve regenerative cells or stem cells. So as you could see by the graphs at the bottom of the slide, there's been a rapid rise in regenerative therapy research in the past years, especially in stem cell research. These graphs were obtained from the U.S. government website, PubMed, that tracks research papers published in scientific journals from all over the world. Since 1970, there have been over 350,000 articles referencing stem cells that have been published. So as you could see, this therapy has been shown to be safe and effective. It's not experimental. This soon will be the standard of care. But currently, as we speak, it is not. And you have to go out of your way to look for it, unfortunately. But here we are. Regenerative medicine treatments include, most commonly, stem cells derived from bone marrow or adipose tissue, platelet-rich plasma, which is platelets from your own blood, and then allografts from amniotic or cord tissue. And we'll get into what those are. So let's talk about stem cell therapy. What is a stem cell? A stem cell is an unspecialized or undifferentiated cell that has the ability to divide and maintain an undifferentiated state, meaning not taking on a specific biologic identity. They function to repair and restore damaged tissues, and they have two characteristics: self-renewal, meaning it could duplicate itself, or multipotency. Multipotency means the ability to differentiate into various specialized cells within different types of cell types. So in this next slide, you could see that a single cell could replicate itself, or it could turn into nerve tissue, it could turn into cartilage, it could turn into ligament, muscle, various tissues that you inject it into. Now, the three common types are ones that are derived methods of delivering regenerative cell therapy is bone marrow, there's adipose derived cells, and then there is the amniotic or umbilical cord cell or growth factor therapy. And the main thing to understand is that all of these therapies work. I am tired of seeing offices that only do one method that just claim that theirs is the best. There is a specific one, and I'm not going to name any names. They only do bone marrow. They're a franchise. But instead of adopting these other evolved ways of delivering cell therapy, all they do is blog about how theirs is the only one that works and none of the others work. And that isn't that's the furthest thing from the truth. They all work. You just have to customize it to the patient that is sitting in front of you. And we are a clinic that do all of the cell therapies, all three of these, so we're not biased towards any. We use all of them, and we customize cater our treatment plans towards the unique patient with a unique condition. So again, it's very important to find a clinic that is not biased towards one form, because again, they all work. So let's talk about where stem cells can be found, specifically adult stem cells. They're found in all tissues and organs of the body, but the highest concentrations are found in bone marrow and fat. So as far as deriving cells from bone marrow, they're usually taken from part of the ileum, They are extracted through a specific method, and then they're spun down to separate the cells from the tissue that you don't need. Those cells are gathered and re-injected into your knee or your hip or wherever you have a degenerated joint. That's where the bone marrow cells are typically derived from. The adipose are derived from taking a fat sample from one of the quadrants of the abdomen here. And again, the cells are separated from the tissue that you don't need and injected into the joint to help regenerate the cartilage. And an allograft tissue, which is either derived from amniotic tissue or umbilical cord tissue, is an alternative method of to obtaining your own cells. You don't have to go digging around in your own body. They're actually, it's an injectable that comes to the doctor's office. This tissue is very carefully screened. It goes through multiple points of inspection, through third-party facilities. And this is immune privileged tissue that has no antibodies or antigens, so meaning that even though it does not come from your body, there is no tissue matching that has to happen, there's no allergic reaction, there's no rejection by your body. It's taken from a very carefully screened donor that has a scheduled cesarean section, and that donor has to be tested to be allowed to be a donor, and then, like I mentioned, the tissue goes through all of the inspection and testing, and by the time it comes to the doctor's office, it is tested for to be clear of everything and just to be a very safe, effective alternative with a consistent volume of growth factors and cells as an alternative to the adult stem cells. And there are reasons why you would use one over the other. If you are 60 and over, your own stem cells drop in number and viability and potency. So for an older person, 60, 70, and 80, you may want to choose an allograft to use some of these younger growth factors and not go digging around in your own body. If you happen to be a 25-year-old or 30-year-old athlete that injured themselves, any method would work evenly. But for the older generation, for ones that don't want to kind of go that extra step of getting it out of your own body, this is a very good alternative. But all of them work, and all of them work well with the right approach. So we just talked about the advantages of an allograft tissue. It's less invasive, obviously, and you get the growth factors and everything else that your joint needs to help regenerate. We talked about the donor eligibility. The donor has to be pre-screened. We talked about all of their assessments and everything that they have to go through in order to become a donor. So again, safe and effective alternative. I want you to see a video of a regenerative therapy treatment being done.
All right, so I'm just cleaning you off. This is chlorhexidine. There is real risk for this. The only risks are infection or bleeding, and we haven't had anything like that. So if you were to scrape yourself, you'd have a risk for bleeding, and that's essentially we're just going in with a needle.
Okay.
Yeah. All right. And then this is just an alcohol swab, a little extra. Just make sure you're clean. And you'll essentially just feel the needle stick, and after that, maybe just a little bit of pressure, but it shouldn't hurt.
Okay.
All right, and we've got it all drawn up here. Got 3 cc's stem cells. Ready to be injected into the left knee joint space. Okay, you ready?
Yes.
All right, on the count of 3, 1, 2, 3. Good. All right, and we're just going to confirm with the ultrasound. Okay, and you'll feel a little bit of pressure as we inject. You doing okay?
Yeah.
Any discomfort right now?
No, I can feel it moving, but it's not bothering me.
Good. And I can have you take that. All right. And they're in.
Okay.
Any discomfort?
No, I feel
No?
fine.
Okay, we'll just put a Band-Aid on that and you are good to go.
Great,
You can
thank
do
you very
anything you
much.
want today. You can shower, you can go for a run. Just look for any signs of infection. We would want to hear back from you. And if you're in a whole lot of pain, we would want to hear from you. Otherwise, we'll just follow up with you.
Okay, great.
All
Thank
right?
you.
So as you could see, this procedure was relatively painless. In this case, this person used an allograft tissue. They didn't pull anything out of their body. It was a pretty simple injection of I believe it was either umbilical cord or amniotic tissue. This is actually a clip from the Healing Miracle. It's a 9-part docu-series. Very, very cool film. And if you guys are interested in seeing more, you could reach out to me and I'll connect you with the folks that made this. But you could see that this is very relatively painless, easy, and this gentleman walked out with a couple of Band-Aids and starting to get healing promoted in his joint. I'm going to show you a couple of before and after images. So these are x-rays 8 weeks apart. Over here on the left side, you could see that the joints were deteriorated. He's looking probably close to like a grade 1 coming up on grade 2 degeneration on the right knee, and then a little deteriorated on the left here. Not too bad. But basically after treatment, 8 weeks. This is after the RegenCore method, by the way. If you just do the injection without addressing the other parts of tissue regeneration, you're not going to get this kind of a result, but this is what we do. And you could see that there has been a pretty clear difference, and this person is out of pain 8 weeks later. It's pretty amazing. Over here is a 10-week before and after. As you could see, the joints were pretty much settled one on top of the other. This isn't quite bone on bone, but this is it's probably grade 2 on both sides. And we took measurements on this 10 weeks later, but you could see even without the measurements that they have more cushion, and of course the person is doing a lot better. So these are the results. Regenerative cell therapy is used to treat osteoarthritis, knee pain, elbow pain, wrist and hand pain, hip pain, shoulder pain, foot and ankle. We don't just do knees. Knees we do a lot of, but we've seen people with rheumatoid arthritis, just as you saw with my mother-in-law. So we've done little joints of the hands, feet. We do see a lot of knees again, but we see all of these other conditions. If it's a degenerative joint, then it would probably respond pretty well to regenerative medicine. So our custom protocol that was developed by Dr. Newer involves several steps. The first step is to have a comprehensive evaluation, which includes a detailed history, an orthopedic assessment, along with a review of images. After that, we create a custom plan, including picking the right modality for you to use for regeneration, as well as functional modalities that address the 4 main components of joint damage, and all of these need to be addressed. Of course, you have the aging joint, you have the mechanics of the joint. So because of Dr. Newer's sports medicine background, she pays attention to the mechanics. She's a master at taping and bracing techniques, so we make sure that the knee is aligned and that everything is tracking the way that it should be, or whichever joint that we're treating. We pay attention to the type of trauma that was received, if there was trauma, and then of course lifestyle. If somebody's walking around at 150 pounds overweight, that also needs to be addressed in order to have a successful outcome. If somebody is smoking and eating McDonald's, every week. That's also something that needs to be addressed because that's going to impact the outcome. So all of this has to be put together and addressed, and now you have a complete comprehensive treatment plan that is going to stand the test of time. And this is what we've developed in the RegenCore method. And for the last step, we take the regenerative properties, they're carefully injected into the joint, the damaged joint, and then healing begins over a period of 8 to 12 weeks. And we follow up for about 6 months to make sure the person is going in the right direction. Now, we have a note to the very active people. In many cases, the pain levels could drop pretty palpably in the first 2 weeks, in the first 4 weeks. So even though this is great to see, and it's great for you to feel less pain this fast, this is not your green light to start breaking records, taking on physical activities that you haven't done in years. We want to ease into your increased physical activity. So we really ask to allow 4 to 6 weeks of just reasonable activity, pretty much doing what you've been doing after the procedure. Anything that doesn't jar your joints. There's no running on pavement, tennis, no basketball or martial arts. You could do some walking, you could do some cycling, swimming is fine. But if you get in pretty good pain relief this early on, it's just very important to kind of know how all of this works, and that you do want to wait about 4 to 6 weeks till you start challenging yourself a little bit. And then when you do it, you want to do it gradually and intelligently. We mentioned talking about the selection criteria of an office. So a few things are extremely important. It's very important that your doctor is qualified. The doctor has to have an orthopedic background or a sports medicine background. Unfortunately, a lot of doctors are getting into this field, some for the right reasons and some for the wrong ones. But again, you have to really find the right doctor. Make sure that the doctor is qualified. Make sure that the doctor is at the clinic full time, and just make sure that the doctor takes a comprehensive approach. The results that you saw above are not simply from just doing the injection and watching the knee joint grow like a flower. What happens is you have to address the mechanical aspect. You have to make sure things are aligned. There are manual things that are done, and there's that joint injection as well. So altogether, it works great. It's a one and done procedure. You don't have to keep coming back. Basically, as a first step, you're going to come in, you're going to get your treatment. There's a follow-up on week 6, in week 12. By week 6, most people are in significantly better shape. And then you come back on week 12. So it's a 3-step, 3-visit process. Of course, you have access to our clinic for course correction or anything else. But you have to do this right, and you have to select the right clinic that does multiple modalities. If somebody just does one modality, that's another reason to continue looking. So I really hope you guys had a good initial exposure. There's so much to learn about regenerative medicine, and we're going to give you an opportunity to learn more. But this was just kind of an initial introduction to see if you're a good candidate, for you to evaluate if you're a good candidate, and to, pique your interest, as it should be. So as promised, we have an opportunity for seminar attendees. If you want to explore this further and get a detailed evaluation, a hands-on physical assessment, an evaluation of your images, a diagnostic ultrasound, and then a determination for a treatment plan, and $500 off of your treatment if you are accepted, you want to register today. So this is a $767 value that seminar attendees get today for $79. Again, what you're going to get is a detailed, comprehensive consultation and a deeper explanation into your regenerative medicine options. You're going to get a hands-on orthopedic assessment with an evaluation of any existing MRIs or X-rays. Or if you need new ones, we'll go ahead and send you out for new ones. You're going to get a diagnostic ultrasound and a treatment plan, whether it's with us or somewhere else. So you're going to get a lot of value out of this treatment, and $500 off your treatment. So I think it's a tremendous opportunity if you have joint pain or damage, and if you're sick of taking medication or you don't want to have surgery in the future. I would highly recommend you guys jump on board here. So I hope to see you guys soon. By the time this is made, you may have some kind of button to click underneath this consultation, or underneath this presentation rather. So go ahead and click it and apply for your evaluation and your opportunity to come in. All right. I hope to see you guys very soon.